Dennis had done everything his doctor told him to do. 71 years old, retired electrician, broad-shouldered quiet man who had spent 40 years working with his hands and who approached his retirement health the same way he had approached every electrical project in his career, methodically, carefully, by the book. His doctor had mentioned at a routine appointment 2 years earlier that magnesium was worth considering for adults his age, said it casually, not a formal prescription, not a specific product recommendation, just a passing comment that magnesium deficiency was common in older adults and that it might help with his sleep, which had been lighter and more fragmented since his late 60s. Dennis went home and did what Dennis did with every piece of information that mattered to him. He researched it thoroughly. He went to the health food store. He read labels for 45 minutes. He asked the store employee which magnesium was most popular. He bought a bottle of magnesium oxide, large bottle, good price, 500 milligrams per capsule. He took one every night before bed without fail for 2 years. His sleep did improve somewhat in the first few months. He told me this at appointments and I noted it. He seemed pleased with his decision. He seemed like a man who had identified a problem and solved it efficiently, the way he had solved electrical problems for 4 decades. At his routine physical in the spring of his 2nd year of magnesium supplementation, Dennis mentioned something he had been meaning to bring up for several weeks, but had kept putting off because he was not sure it was worth mentioning. He said he had been having some irregular heartbeats, not painful, not dramatic, just occasional moments where his heart seemed to flutter or skip. He had noticed it mostly at night, sometimes in the early morning. He had attributed it to aging and had almost not mentioned it. I ordered an EKG immediately. The results showed a pattern of cardiac arrhythmia that had not been present at any previous assessment. Intermittent, not immediately life-threatening at the level we were seeing it, but real, documented, and requiring urgent investigation. Over the following 2 weeks of comprehensive assessment, cardiology review, and detailed patient history, a picture emerged that connected Dennis's 2 years of nightly magnesium supplementation to his cardiac symptoms in a way that neither he nor I had anticipated, and that his original casual recommendation had never once mentioned a possibility. Dennis was not having a magnesium deficiency problem. He was having a magnesium toxicity problem. Accumulation. 2 years of 500 milligrams nightly in a 71-year-old body with the naturally reduced kidney clearance efficiency of his age had created a magnesium burden that his cardiovascular system was communicating about in the only language available to it. His heart. My name is Dr. James Harlow. I have spent 10 years in internal medicine with a focused specialization in cardiovascular and metabolic health in adults over 50, and in that decade, magnesium supplementation has become one of the most universally recommended and most consistently misapplied interventions I encounter in my older adult patients. The enthusiasm is understandable. Magnesium genuinely matters. Magnesium deficiency is genuinely common in adults over 60. The benefits of correcting true deficiency are genuinely significant for sleep, muscle function, blood pressure, and cardiovascular health. I discuss magnesium with my patients regularly, but there is a complete picture around magnesium supplementation in older adults that the supplement industry, the wellness content space, and even some well-intentioned physicians consistently fail to provide. A picture that includes not just the benefits of adequate magnesium, but the specific and serious risks of the wrong form, the wrong dose, and the wrong monitoring in a 71-year-old body with aging kidneys and a cardiovascular system that is more sensitive to electrolyte disturbances than it has ever been. Today I am going to tell you Dennis's complete story. I am going to explain exactly what different forms of magnesium do differently inside the aging body. I am going to tell you who genuinely benefits from magnesium supplementation and who is quietly accumulating risk. And I am going to give you the complete framework for having an informed conversation with your doctor about whether magnesium is right for you, and if so, exactly which kind and exactly how much. Please stay with me through every minute of this video, because several things I am about to tell you will directly contradict advice you have received from sources you trust. And please share this before you finish watching, because right now someone you love is taking magnesium every night before bed, believing they are doing something wonderful for their heart. They deserve to know what Dennis's EKG showed me. Let us begin. Why magnesium became the most recommended supplement for older adults. Before I tell you what was happening inside Dennis every night for 2 years, I want to be completely honest about why magnesium earned its reputation. Because this video is not about telling you that magnesium is dangerous and you should stop taking it. It is about telling you the complete truth. Magnesium is the 4th most abundant mineral in the human body. It is involved in over 300 enzymatic reactions. It plays a direct role in regulating blood pressure, through its effects on vascular smooth muscle tone. It supports the electrical stability of the heart. It is essential for proper insulin function and blood sugar regulation. It supports bone mineral density. It modulates the stress response and supports healthy sleep architecture. It is involved in protein synthesis, nerve function, and muscle contraction. These are not invented claims. These are well-documented physiological roles, supported by decades of biochemical research. And magnesium deficiency is genuinely common in adults over 60. Studies suggest that between 60 and 75% of older adults in developed countries have magnesium intake below recommended levels. Several factors specific to aging amplify this problem. Magnesium absorption from food decreases as digestive efficiency declines with age. Many common medications, including diuretics, proton pump inhibitors for acid reflux, and certain diabetes medications directly increase magnesium loss through the kidneys. Poor dietary quality in older adults who are eating less overall or eating fewer magnesium-rich whole foods further depletes intake. So when a physician mentions casually that magnesium might be worth considering, or when a wellness video enthusiastically recommends magnesium for sleep and heart health, or when a health food store employee points toward the best-selling bottle on the shelf, there is genuine biological reasoning behind all of it. Note what is missing from all of it is the complete picture. The picture that includes the critical differences between magnesium forms. The picture that includes the dose thresholds that matter specifically in aging kidneys. The picture that includes the cardiovascular monitoring that responsible magnesium supplementation in older adults requires. And the picture that includes the specific conditions under which magnesium supplementation stops being protective and starts being harmful. Dennis had half the picture. His heart was trying to show him the other half. The first critical problem. Dennis was taking the wrong form. There are multiple forms of magnesium available as supplements. Magnesium oxide, magnesium glycinate, magnesium citrate, magnesium malate, magnesium threonate, magnesium taurate, a different primary site of action in the body, a different therapeutic application, and a very different safety profile in older adults. Dennis was taking magnesium oxide, the most commonly sold form, the form most likely to be on the shelf of any pharmacy or health food store. The form most likely to be what a store employee recommends because it is familiar and inexpensive, a 500 mg capsule that looks substantial and authoritative on a large professional-looking bottle. Magnesium oxide has the lowest bioavailability of any common magnesium supplement form. Bioavailability means the proportion of the supplement that actually gets absorbed into your bloodstream and reaches the tissues that need it. Research consistently shows that magnesium oxide has a bioavailability of approximately 4%. 4%. For every 500 milligrams Dennis swallowed, approximately 20 milligrams was being absorbed into his bloodstream and utilized by his cells. This sounds like it would make magnesium oxide harmless. If it is barely absorbed, how could it cause problems? Here is what Dennis and the vast majority of people taking magnesium oxide do not know. Although the unabsorbed 96% of magnesium oxide does not simply pass through harmlessly, it has significant effects in the gastrointestinal tract. It draws water into the intestine osmotically. It irritates intestinal lining with chronic daily exposure, and in some individuals, particularly older adults with more permeable gut lining and more reactive gastrointestinal systems, a proportion of that unabsorbed magnesium load is eventually processed through pathways that place a burden on kidney clearance mechanisms that are already operating at reduced efficiency. Additionally, because magnesium oxide delivers such poor bioavailability to tissues, many older adults who begin taking it for genuine magnesium deficiency-related symptoms find that their symptoms do not fully resolve. They then increase their dose, or they add a second magnesium product alongside the first, creating a cumulative magnesium load that their aging kidneys are progressively less equipped to manage. Dennis had taken 500 milligrams of magnesium oxide every night for 2 years. His kidneys, operating at the reduced filtration efficiency normal for a 71-year-old man, had been clearing this load imperfectly, slowly, quietly. The accumulation had been invisible in his standard lab panels because magnesium is not part of a routine metabolic panel and nobody had thought to check it specifically. His blood magnesium level when we finally measured it was above the upper limit of the normal range, not dramatically, not to the level of acute toxicity, but elevated enough to affect the electrical conduction system of his heart in the way his EKG was, now documenting for both of us to see. The second critical problem. The dose nobody had calculated for his specific body, 500 milligrams of magnesium per night. Dennis had chosen this dose because it was the dose printed on the bottle he had purchased. The standard dose, the default. Here is what nobody told Dennis, and what the bottle did not explain. The appropriate supplemental magnesium dose for an older adult is not a fixed universal number. It is calculated based on dietary magnesium intake, kidney function, existing magnesium status, body weight, and the specific form of magnesium being used. A dose that is appropriate for a 45-year-old with full kidney function may be excessive for a 71-year-old with the age-related kidney function decline that Dennis carried. The kidneys are the primary route of magnesium excretion. When more magnesium is consumed than the body needs, healthy kidneys excrete the excess efficiently and completely. This is why magnesium toxicity from supplementation is uncommon in young adults with healthy kidneys. Their kidneys simply clear what is not needed. But aging kidneys clear magnesium less efficiently. The same dose that a 45-year-old clears without accumulation becomes a dose that a 71-year-old accumulates gradually over months and years. Not dramatically, not rapidly enough to produce obvious acute symptoms, but steadily, quietly, in a way that only becomes visible when the accumulation reaches the threshold at which the heart's electrical system begins to respond. Research published in the Journal of the American Geriatric Society examined magnesium levels in community-dwelling adults over 70 who were taking standard-dose magnesium supplements. A significant proportion showed blood magnesium levels above the optimal range, despite taking doses considered safe in younger adult populations. The researchers concluded that standard supplementation dose recommendations do not adequately account for the reduced renal clearance efficiency of older adults, and that magnesium monitoring, essential in this population. Dennis quote, S dose had never been calculated for Dennis. Specifically, it had been calculated for the label on the bottle, and the label on the bottle had been written for a population that did not include the specific kidney function profile of a 71-year-old retired electrician who had never had his magnesium level checked in 2 years of nightly supplementation. The third critical problem. What elevated magnesium does to the aging heart. I want to explain exactly what was happening to Dennis's heart so that you understand why this matters beyond the numbers on a lab panel. Magnesium plays a critical role in cardiac electrophysiology, the electrical system that coordinates your heartbeat. In appropriate concentrations, magnesium stabilizes cardiac cell membranes, supports normal conduction velocity through the heart's electrical pathways, and protects against the arrhythmias that become more common in older adult hearts. This is why low magnesium, true magnesium deficiency, increases cardiac arrhythmia risk. And this is the basis of the genuine and well-founded recommendation that older adults maintain adequate magnesium status for heart health. But here is the complete picture that the recommendation almost never includes. The relationship between magnesium and cardiac electrical stability is not linear. It is not a situation where more magnesium always means more stability. It is a situation where too little magnesium destabilizes cardiac electrical function, and too much magnesium also destabilizes cardiac electrical function. Both ends of the spectrum are dangerous. The optimal range in the middle is protective. Elevated magnesium reduces the speed of electrical conduction through the heart's specialized conduction system. It slows the movement of the electrical impulse from the atria to the ventricles through the atrioventricular node. It reduces the automaticity of cardiac pacemaker cells. In severe hypermagnesemia, these effects can progress to complete heart block and cardiac arrest. In the mild to moderate elevation that Dennis had accumulated over 2 years, the effects were subtler. Intermittent arrhythmias, moments of altered conduction, the flutter and skip he had been noticing at night, and in the early morning, his heart's electrical system responding to a mineral imbalance that had been building slowly and invisibly since the night he first opened that bottle 2 years earlier. He had been taking magnesium specifically because he had been told it was good for his heart. The accumulation of that magnesium had been quietly disrupting the very cardiac electrical function it was supposed to be protecting. A study published in Circulation, the flagship journal of the American Heart Association, examined the relationship between serum magnesium levels and cardiac arrhythmia risk in adults over 65. The findings showed a U-shaped relationship. Both low and high magnesium levels were associated with significantly elevated arrhythmia risk compared to optimal mid-range levels. And the study specifically highlighted that supplementation without monitoring in older adults was a clinically significant contributor to the elevated magnesium levels associated with increased arrhythmia risk in this population. Dennis had been trying to sit in the middle of that U-shaped curve. Without monitoring, he had drifted to the wrong side of it. And his heart had been trying to tell him for weeks before he finally mentioned it to me. The fourth critical problem. What Dennis's magnesium was interacting with. Dennis was also taking a calcium supplement. His primary care physician had recommended it years earlier for bone density support. 1,000 milligrams of calcium daily, standard recommendation, widely given to older adults across the country. What neither Dennis nor his physician had considered when the magnesium was added to his routine was the physiological relationship between magnesium and calcium in the body, and what daily high-dose calcium supplementation does to magnesium balance and utilization. Calcium and magnesium compete for absorption in the intestine. They use the same transport mechanisms. When calcium is present in high amounts in the intestinal environment, it competes with and reduces magnesium absorption. This means that Dennis's daily 1000 mg calcium supplement was actively reducing the proportion of his magnesium oxide that was being absorbed. This sounds counterintuitive given what I have just told you about his elevated magnesium. But here is the complexity that makes this situation genuinely dangerous for older adults. The reduced absorption of magnesium caused by his calcium supplementation meant that less magnesium was reaching his tissues and cells. His cellular magnesium status was not well replenished. His sleep was still somewhat disrupted. His muscle cramps, which had been part of the reason he started magnesium, were incompletely resolved. Meanwhile, the unabsorbed magnesium burden in his gastrointestinal tract and the partial kidney clearance of the fraction that did absorb had been accumulating over 2 years in ways that showed up in his blood levels, even without effective cellular delivery. In other words, his calcium supplement was reducing the therapeutic benefit of his magnesium while not preventing the accumulation that was affecting his heart. He was getting the risk without getting the full benefit, all because two supplements that seemed unrelated were interacting through shared physiological pathways that nobody had mapped out for him. A study published in the American Journal of Clinical Nutrition found that the ratio of calcium to magnesium intake was a critical determinant of cardiovascular outcomes in older adults, specifically that high calcium to magnesium ratios, exactly the pattern created by high-dose calcium supplementation combined with inadequate or poorly absorbed magnesium, were associated with elevated cardiovascular risk, including arrhythmia. The researchers recommended that calcium and magnesium supplementation in older adults be evaluated and dosed together rather than as independent inventions. Dennis's physician had recommended calcium, a casual comment had led to magnesium, nobody had looked at them together, nobody had considered the interaction, nobody had monitored the result. What happened to Dennis? I want to tell you the complete outcome of Dennis's story because I believe you need to hear all of it. When I explained the full picture to Dennis, he did what Dennis always did with important information. He sat quietly for a moment. He processed it. He asked 2 precise clarifying questions. And then he nodded in the way of a man who has understood something completely and is already calculating what to do differently. We stopped his magnesium oxide immediately. We reduced his calcium supplementation dose and changed the timing of it to reduce competition with the magnesium replacement we were planning to introduce. We waited 4 weeks for his elevated magnesium level to normalize through natural renal clearance. During those 4 weeks, his cardiac arrhythmia episodes decreased significantly. By the time we remeasured his magnesium and confirmed it had returned to the optimal range, his intermittent heart flutter had resolved almost completely. I then reintroduced magnesium supplementation in the correct form for his specific needs. Magnesium glycinate, a highly bioavailable chelated form with gentle gastrointestinal tolerability and excellent tissue delivery, at a dose calculated specifically for his kidney function, his dietary intake, and his body weight. At 200 mg rather than 500, with scheduled blood magnesium monitoring every 4 months. At his 3-month follow-up, Dennis's sleep quality had improved beyond even what it had been during his 2 years on the wrong form. His muscle cramps had resolved, his blood pressure had improved modestly. His cardiac monitoring showed normal sinus rhythm without the arrhythmic episodes that had brought him to my attention. He told me at that appointment, something that I want to share with you directly. He said, 40 years as an electrician, you know what I learnt in 40 years? The right tool for the right job, the right wire gauge for the right circuit. You use the wrong component, and the whole system fails. I was using the wrong component. He was right. He had been trying to do the right thing with the wrong tool. And nobody had handed him the specifications that would have told him the difference. The right way to approach magnesium after 60. I want to give you everything Dennis needed to know before he opened that first bottle. The complete picture, not just the warning, but the constructive path forward. If you are considering magnesium supplementation after 60, or if you are currently taking magnesium and have never had your blood magnesium level checked, here is the framework that responsible magnesium management in older adults requires. First, have your blood magnesium level measured before starting any supplementation. This is not a standard part of a routine metabolic panel. You need to ask for it specifically. Your doctor needs to know your baseline before supplementation begins. Without a baseline, you cannot know whether you are genuinely deficient, borderline, or already in the normal to high range that would make supplementation unnecessary or dangerous. Second, if supplementation is appropriate, choose the right form for your specific goal. Magnesium glycinate is the most widely appropriate form for older adults seeking general magnesium repletion, sleep support, and cardiovascular benefit. It has high bioavailability, excellent tissue delivery, gentle gastrointestinal tolerability, and a well-established safety profile in older adults when dosed appropriately. Magnesium oxide is the least appropriate form for therapeutic supplementation in older adults, despite being the most widely sold. Magnesium citrate has reasonable bioavailability but strong laxative effects that can cause dehydration in older adults. Magnesium threonate has emerging research supporting cognitive benefits, specifically, and may be appropriate for that indication under physician guidance. Third, dose based on your specific profile, not based on the label. Ask your physician to help you calculate an appropriate dose based on your dietary magnesium intake, your kidney function, your body weight, and your specific deficiency level. For most older adults with mild to moderate deficiency, doses between 100 and 300 mg of a bioavailable form are appropriate. 500 mg of a poorly absorbed form is not a safe default for a 71-year-old body. Fourth, monitor regularly. Blood magnesium should be rechecked 3 to 4 months after starting supplementation and every 6 months thereafter. This is not optional. It is the only way to know whether you are in the protective middle of that U-shaped curve or drifting toward the side that increases your cardiac risk. Fifth, tell your doctor every supplement you take, including magnesium, the interactions between magnesium, calcium, certain blood pressure medications, certain diabetes medications, and certain cardiac medications are real and clinically significant. Your doctor cannot manage these interactions without complete information. Sixth, consider dietary magnesium before supplementation. Pumpkin seeds are extraordinarily magnesium rich. Dark chocolate above 85% cacao, avocado, almonds, black beans, freshly cooked dark leafy greens, whole grains. For many older adults with mild magnesium insufficiency, meaningful dietary improvement can normalize magnesium status without the risks that supplementation carries. Discuss with your doctor whether dietary optimization alone is sufficient for your specific situation before reaching for the bottle. The bigger picture Dennis taught me in 10 years of practice. I have learned that the supplement industry operates in a space that sits between food and medicine without being fully governed by the standards of either. Foods are consumed with an understanding that individual variation in response is normal and that no single food is universally beneficial in unlimited quantities. Medicines are prescribed with specific doses, specific monitoring requirements, and specific attention to individual patient factors, including age, kidney function, and concurrent medications. Supplements are sold with the marketing of medicine and consumed with the casualness of food. In older adults whose physiology has changed fundamentally from the average adult population on which most supplement dosing guidance is based, this gap between marketing and reality is where harm accumulates quietly. Dennis did not buy a dangerous product. Magnesium is not a dangerous mineral. He bought a product that was appropriate for some people at some doses under some conditions, and consumed it for 2 years as though it were appropriate for him, specifically without the individualized assessment that responsible supplementation in an aging body requires. He was not irresponsible. He was underinformed. And the difference between those two things is the complete picture that I am here to provide. His heart is beating normally now, in the right rhythm, with the right electrical coordination, because we caught what was happening early enough to correct it completely. Not every story ends this well without that conversation.